Good morning. It's 11:15 on the dot, Chinta. It is 11:15, a quarter past 11 hour. We're doing Health on Traxx. Our guest in the studios is Vanessa, Liang, Lu, Wen. Hi, Vanessa.
Hi, everyone.
Oh, lovely. You have a lovely voice. Nice. Okay. How are you doing?
I'm good. Thank you for having me.
Oh, thank you for coming. And otherwise, what would you be doing at this time?
I'll probably be at work.
And how is that at work?
Okay, I'm a clinical pharmacist at Hospital Tunku, Azizah. So basically what I do is I participate in ward rounds together with the doctors and the nurses. So what I do in the ward is, basically I'm like a drug consult. So in terms of like drug optimization or just suggesting alternatives, so that's what I do on a day-to-day basis.
You're quite different from the pharmacist at the
counter
store.
dispensary.
Yes, very different, isn't it?
Yes,
right.
That's true.
So you would actually go out there and like you said, you would suggest alternatives if they need.
Yes.
And a lot of people sometimes, maybe if you have an allergy against aspirin or something, and then what else to take?
Yes, correct.
Right.
Yeah.
How long you been doing this?
Well, for the past 18 years.
18 years.
Yeah.
How'd you get involved? Why did you like it?
Well, I've always been intrigued by how medicines actually work in our bodies. So I thought, the best way is to study pharmacy.
Right.
And I guess that's where I am today.
Were you a menace when you were young with all the medicines at home? Like, where's this Panadol? Where's this?
No, I think I was quite a sickly child. So I had a lot of experience with medication.
Right.
Yeah.
And
so that's why I'm in pediatric pharmacy now.
Okay.
Yeah.
All right. So you started and with kids and all that, right?
Yes,
so
correct.
How do you get kids to, I don't know, sometimes they're not giving out sweets anymore.
No.
Right?
Yeah.
Yeah, my mom used to trick me like, okay, we'll give you $1 if you swallow that pill and stuff. And then we'll
incentive.
We'll do the, hide it in between, at the top, the gums. And then open your mouth and then after it goes to the toilet.
Okay. I'll be ready to check that on the kids.
Yeah, but you know what happened? There was a side effect from that, We got used to the bitterness. Having to hide that pill in the mouth, right?
So why not just swallow it?
So in the end, I could actually take pills without having water. In the end, right? But never mind. It's not about me this morning. Come, let's talk about what we're here to do. Protect, prevent, immunize, yeah? We're talking about vaccines today.
Correct.
And how important is it that people should know about vaccines?
Well, it is life-saving. Vaccinations are life-saving because they protect against serious diseases. Yeah.
Right. And there are many things that are going on around about vaccines. We'll get into it as we go along, right? There are people out there who, I call them the coffee shop experts, who would sit down over there and tell everybody else, do this and don't do that and don't do that and don't do this and do this.
Yeah.
Right? And there could be wrong information. So we'd like to set that straight this morning, yeah? Okay, question number 1. What are vaccines and how do they protect against diseases?
Well, vaccines are not something new. They have been around and in use for the past 2 centuries, in fact. And beginning with the smallpox vaccine that was developed in 1796. So since then, many more vaccines have been developed, able to protect against a wide range of diseases. So vaccines actually contain an active component, as we call it, the antigen. So this antigen is actually made up of weakened or inactivated virus or bacteria, or maybe some parts of them, like a genetic material or protein. So what they do is that they elicit or they produce an immune response in the body, but without causing the disease itself. So when a person gets vaccinated, the body recognizes this antigen as a foreign substance. So it then activates the immune system to then produce antibodies and create memory of this virus or bacterium so that the body is ready to fight it off once it is encountered in the future. So this is what makes vaccines so effective, because rather than treating a disorder or a disease once it occurs, vaccines actually provide protection by preventing it and also reducing the harm that can come about by these diseases.
When we had COVID, a lot of people understood, right, that you were actually being given the COVID variant, or what was it that you were given?
We were given actually a component. Yes.
Right. So you had that, and then the body just develops, like you said, right?
Yes.
It learns to fight that.
The immune response to produce the antibodies that are needed to fight off the disease if we were to encounter it. Yeah.
Right. So what kind of process goes into making all these vaccines? Very heavy.
Yes, a lot of clinical research needs to be undergone to actually get a vaccine out in the market. It is not something that is done overnight. it takes years and years of research.
And who are the people behind this? What kind of, what would you need to study for to become somebody who's actually in that field?
Well, it's actually a combination of maybe like pharmacologists, immunologists, those that are familiar with the bacteria or the virus per se as well, so that can give input and how to manufacture and design the vaccines needed.
Nice.
Yeah.
Okay. I'm just thinking of kids who are like leaving school and all that. Huh?
Yeah.
And if they want to get into this field and they want to be somebody who could be, a lifesaver in the future for something that they've done. Yeah. So what should they pursue?
Well, I guess they could pursue, the foundation would be in science, and then they can go on from that.
Okay.
Yeah.
All right. So definitely not for me, right? Chenta, how about you? Look at her. She's keeping quiet. Okay. Now, can you tell us more about the Malaysian National Immunization Program for prevention of childhood diseases? That's your expertise, isn't it?
Yeah.
Okay.
Okay, for the National Immunization Program for Malaysia, it began in the 1950s and has since progressed based on the recommendations from the WHO Extended Immunization Program. So this NIP actually aims to safeguard children's health from vaccine preventable diseases. So currently, the NIP protects children from 13 vaccine preventable diseases, namely the measles, mumps, rubella, diphtheria, pertussis, tetanus, Japanese encephalitis, polio, tuberculosis, Haemophilus influenza type B, human papillomavirus, hepatitis B, and pneumococcal diseases. So it sounds like a mouthful, I know.
Thank goodness you're doing it.
Yeah, but these vaccinations are actually scheduled at specific time intervals from birth right up to the age of 15 years old, according to the NIP schedule. Yeah, so this schedule is actually regularly reviewed, and it takes into account the local burden, disease burden, and also the safety, efficacy, and cost effectiveness of these vaccines. So this ensures that the NIP recommendations are current, they're up to date, and they're evidence based.
Right. So, wow, interesting, isn't it? And the ways of giving a vaccine, some get jabs, some get that
Mostly,
little
yes.
scratch thingy.
Scratch. Most of them will
Yeah.
be given through intramuscular injections.
Uh-huh.
So we also have some vaccines that are given orally.
Okay,
like the,
okay.
Yeah, like the rotavirus vaccine, they're given orally.
Right. And is it true that, Malaysians we've got very distinct BCG, was it?
Yes,
And,
yes.
and it's like easy to tell a Malaysian from other nationalities.
Yes. I guess it's in our genes.
Yeah. Right. I know sometimes, let's not sound too gory here, but when they find, bodies, the police cases, and then they're not sure whether it's a foreigner or a local, they actually can tell, right? With the BCG.
Okay, I didn't know that used this criteria.
I don't know. I've just heard,
Okay.
Okay, forget that. Scrap that. Okay. Now, what role do pharmacists play in supporting the National Immunization Program?
Okay, so pharmacists actually play a crucial role in supporting immunization efforts, which can be broadly categorized into 4 key areas. So enhancing vaccine access, monitoring and reporting of vaccine safety, which we call as pharmacovigilance, ensuring proper vaccine storage and handling, and also providing public education and promoting vaccination advocacy. So all vaccines brought into the country, they need to undergo very strict pre- and post-licensing evaluations by the National Pharmaceutical Regulatory Agency, the NPRA, to ensure their quality, safety, and efficacy. So once a vaccine is approved and made available to the public, so post-marketing surveillance is carried out continuously to monitor its performance, including any rare or unexpected side effects. So pharmacists are actually involved in this process by monitoring and reporting adverse events following immunization through national surveillance systems.
Right.
Yeah.
Okay. What are some of the common myths and misconceptions about vaccination, and how would you address them?
Well, the top on my list
Okay.
would be the misconception or the misinformation that vaccines cause autism. Have you heard of this?
Yes, I have.
Yeah. So a lot of extensive scientific research has been done globally to try and find whether there's really any connection. And through extensive studies, there actually has been no evidence to support this claim. So the largest of these studies actually looked at over 500,000 children in Denmark, and they found that children who were vaccinated were no more likely to get to develop autism compared to children who were not vaccinated.
Right.
You know, and in fact, the original paper that cited this connection was actually then found to be scientifically flawed. They had huge ethical compromise and also was based on falsified data.
Right.
Yeah. So needless to say, that paper was retracted.
Right. And it's very dangerous, isn't it?
Yes.
When things can be life-saving and can actually help, it's pushed aside because of, what my uncle said, what my auntie said.
Yes.
And because they believe in it, right?
Yes.
So how did this start, actually? I mean, like you're saying, unethical and no scientific backing behind it and all that. But what was the claim?
The claim was that the MMR vaccine was seen to somehow be linked to an increased risk of developing autism. Yeah, but that has been debunked.
Right.
Yeah.
So okay, that's one over there, yeah.
Yes.
And how serious a problem is it in our country?
Well, I guess our Ministry of Health has been putting in a lot of effort and campaigns to promote vaccinations, actually. Yeah, so I would feel that our Malaysian community is rather open to vaccinations, which is a good thing because then our community can be protected.
Right. Yeah. And when you do run into problems in Malaysia, what are the problems? And who are the ones who are, giving problems? Sounds like a school teacher meeting.
Well, I would say, I won't put blame on anyone.
Right, okay.
Right? But maybe some in the community may be misinformed. Yeah, so it actually is a lot of responsibility on our part to set the record straight. Yeah, to give out the correct information, which is evidence-based, and not to just take, hearsay here and there. Yeah,
right.
as facts. Yeah.
Right. Hence the reason why you're also here today. Yeah.
Yes, correct.
To also set this record straight. Right. And they can get some information from you as well beyond this interview this morning.
Yes.
And where can they go to?
Okay. So they can actually call the National Pharmacy Call Center. Yes, which I will give details later on. But the hotline I'll just mention here is 1-800-88-6722.
Okay, get that number, right? Before we end the show, we'll do that again. Our guest in the studio, Vanessa Liang, she's a pharmacist from Hospital Tunku, Azizah, Kuala Lumpur Women and Children Hospital in Kuala Lumpur. And we're talking about protect, prevent, and immunize. It's vaccinations we're touching on. All right, other myths and things you've heard.
Yes, well, another myth is that a lot of people have this misconception that vaccines can overwhelm the immune system. Well, I believe that this worry stems from the belief that the immune system can only tolerate, a certain amount of threats. All right. But the truth is, children are exposed to thousands of antigens daily through the food they eat, the air, the surfaces they touch. So vaccines only contain a tiny fraction of antigens that children are bound to expose in their everyday lives. Yeah. So even when the children get multiple vaccines at one go, all right, the vaccines contain antigens that are very small in comparison, and actually it will not overwhelm the immune system.
Right. And what kind of problems do children who don't get vaccinated get?
All right. So if a child is not vaccinated, then they run the risk of being exposed to a actually vaccine preventable disease. And when they're exposed to people who carry the disease, it is something that we cannot predict. Nobody can predict. Yeah, so we're actually protecting them from serious complications.
Right. And things that were like polio and all that before, it was so hard to treat. But
yes. But now Malaysia has achieved zero polio cases.
Because of vaccination?
Yes. So we have eradicated polio in Malaysia.
Nice.
Yes.
Okay. And then, I know you're not a vet, but yeah, does this work the same way with pets? Yeah?
Pets. Oh,
Vaccination for pets.
I'm not qualified to answer this question.
Cheta, can you answer this question? Right. Okay. So yeah, but vaccinations, huh? So how do they work? Okay. Other misconceptions?
Well, some will.
I like the misconceptions. It's interesting because you hear a lot of things.
Yeah.
And I've got one at the top of my mind, but which we'll get to later. But go.
Okay. So some parents would think that my child, let them just get the disease, the natural way. Then they can produce their own antibodies the natural way, right? So while it is true that natural infections do lead to immunity, All right. But it actually comes at a very high cost because this then increases the risk of serious illness, long-term complications, and even in serious cases, death.
Ouch.
Yeah. So, for example, a natural infection to measles, all right, can cause conditions such as pneumonia, brain swelling, and also permanent disability. But, vaccines provide a way for our body to build immunity without having to go through the illness. So isn't that a better option?
It is, yeah. So how would you explain it to them, right? There's always that comparison about those days, right? Grandpa, grandma never had to do this, never had to do that. And then, now this is something that has to be done, right? What do you say to people who give that kind of a answer?
Well, I would point that there has been much advancement in terms of in the medical field, that we don't have to go through what our ancestors have gone through, and that we have means of preventing serious complications of diseases through vaccines. And, there's no need to go through these complications when we have ways to prevent them.
Right. So, and there are a lot more things that we are exposed to nowadays. Yeah?
Yes, correct.
And so there are a lot more different problems that we have now. So to make that comparison before and now, it's
a bit, it's like apple and orange kind of comparison. Yeah.
Okay. What about the COVID vaccine? And a lot of people saying that, because they had that vaccination, that's the reason why some of them are dying or something like that. Heart attacks and all that, the increase.
Okay. Well, there needs to be more studies into this.
Mm-hmm.
Yeah, but what we can see through the COVID-19 vaccination program is that the death tolls have come down tremendously. And I think that is the main aim that we were looking at the pandemic. Because at that time, nobody was, nobody had any clue this was a new virus that had surfaced, and it is through the vaccines that many lives have been saved. Yeah,
right.
I think that's the crust of it.
Correct. So important, yeah?
Yeah.
All right. So take a lot of positives from this. Now, okay, so you've done the common myths and misconceptions, yeah? Is it true that vaccines contain harmful ingredients like aluminum and mercury?
Okay. Well, aluminium is actually present in our everyday things that we see every day, like in our soil, in the water that we drink, in some food that we take, right? So it's nothing that it is out of the norm. So the aluminium actually contained in these vaccines, they act as adjuvants to boost the effect of the vaccines, and the content is actually very, very minute. Yeah, and it is within safe levels. Yeah. So you mentioned mercury, right? So mercury is used as a preservative in some vaccines, but of the late, manufacturers have switched to using single-use vaccines. So this means they don't need to use that preservative because it's single-use. Yeah. So actually, the manufacturers have already shifted to reduce the use of mercury. But just to set the record straight, all right, this mercury that is contained in vaccines is actually very different from the mercury that we have in mind about, like toxicity when we think of poisoning, mercury poisoning. All right, so the mercury that is contained in the vaccines are actually ethyl mercury, all right, which is a compound that actually is able to be excreted from the body pretty fast, compared to methyl mercury, which is what we see in, like deep sea fishes, like swordfish, tuna, that if ingested in high levels can lead to some serious effects.
Oh, where are the fish picking that up from?
Well, usually it happens in the bigger fish. So the bigger fish prey on the smaller fish, and that's where the accumulation of mercury comes from. Yeah. Okay. So it usually happens in like deep sea fishes, right. Big ones.
So you big fish who keep on picking on the small fish, that's what happens to you. Yeah. All right? So you leave the small fish alone. Okay, we go for a short little break over here. We'll be back. I'm going to play a little PSA on smoking. So pay attention. I'd like you to pay attention to this too. Back with our guest in the studios over here this morning. On a Monday morning, we're doing Health on Traxx. We're talking to Vanessa Liang. She's a pharmacist with Hospital Tunku, Azizah, Kuala Lumpur Women and Children Hospital. You got your gang listening over there?
I hope so.
Yeah? I'll say hi to
Hi,
good morning to everybody. Yeah, she needs a nice little nasi kandar when she gets back to work. Do you like nasi kandar?
Absolutely.
Okay, all right. So nasi kandar. Boss, get her some nasi kandar later when she gets back to work. She's doing a great job in the studios over here talking about protect, prevent, immunize. We're talking about vaccinations, yeah? And did you hear that smoking PSA earlier? I was talking to you in the studio, so you couldn't hear everything. So when he says like, now I get to breathe fresh air, right? And then he goes... Now tell me, Vanessa, who takes in fresh air that way? Doesn't that sound like somebody taking in a puff of smoke?
Actually, it does.
Okay, Double D. All right, it's our DJ, Double D. Anyway, all right, some parents believe that vaccine-preventable diseases are a normal part of growing up and that it's better for children to develop immunity naturally, like you covered just a while ago, rather than through vaccination. And you responded to it already. Have you got anything further to say to that?
Yes. Well, as parents, I think it's our duty to protect our children. Yeah. So instead of waiting for a natural infection to occur and for them to gain natural immunity, let's look to vaccination so that we can protect them from the serious complications of these diseases.
Right. So find out more about that. Yeah. What are the ages where they should be vaccinated? They should get their vaccinations?
Okay. So under our national immunization program, it runs from birth right up to when they are 15 years old.
Up to 15 years old,
Yes,
right?
yes.
And then after that?
Then after that, there'll be boosters here and there. And then it is up to us when they reach adulthood. Then it's like for us, we have our annual flu jabs that we should be taking.
Should be taking, okay.
Yes, yeah.
And a lot of people don't, yeah?
Yeah.
Yeah, and especially what about the old fogies? I mean,
Well, I guess they most of them think like, oh, it's just a flu. You know, I'll get better. You know, after a few days, just sleep it off. You know,
Right.
But actually, some of the flu cases can be pretty severe. All right, and actually, it's not only about protecting ourselves, but
Right.
also protecting people around us, because we may come into contact with people who are more vulnerable, like the elderly or young infants, or people who may have medical conditions like asthma or heart conditions or cancer, you know. So they are immunocompromised in the sense, and, you know, we should protect them.
Right. We hear about, some countries, we hear people dying from the common flu. And it doesn't happen here, right? You know, like in some places, the flu is like, they got the flu and they can actually die from the flu. And
Usually,
that's because of?
Usually people who have very severe reactions are those who, as I mentioned, have underlying medical conditions. Yeah, so they are at higher risk for severe complications.
Right.
Yeah.
So who are the ones who should really be careful?
Those who are elderly,
Okay.
Yeah,
And
so-
what underlying conditions you say?
like asthma,
Okay.
heart conditions, yeah, or those are on chemotherapy who have cancer. So their immune system is already,
Compromised.
Yes, compromised.
Right. Okay. So important, yeah. As a pharmacist, what advice would you give to a parent who believes that vaccination is not necessary? I think you've touched that too, because other children around their child are already What's
Yeah.
this that thing
Okay.
about? What do you call that when you had a
Herd
group?
immunity.
Right.
Yeah, herd immunity. So this is actually the concept of herd immunity. So yes, a single child's chance of catching a disease is much lower if everybody else is vaccinated. But the level of immunity needed to achieve this herd immunity depends on how contagious the disease is in the first place. All right. So for instance, highly contagious disease like measles, all right, they require 95% of the population to be vaccinated in order to prevent the ongoing transmission. Yeah, so in essence, herd immunity can only work when a very high percentage of the population are vaccinated. If too many people opt out of vaccination, they opt not to be vaccinated, then this collective protection then breaks down. All right, and this increases the risk of outbreaks, even in diseases that were once well controlled. Yeah, so this is the scary part. Yeah. So we also must take into mind that unvaccinated children remain vulnerable, as I mentioned earlier, because we don't know whether they will come into contact with somebody carrying the disease, right? And they themselves are not protected. Yeah.
Important, yeah. And then a lot of people who didn't get vaccinated during COVID, and were they actually the ones who are actually benefiting from herd immunity?
I would say to a certain extent, yes, but we shouldn't we shouldn't take this for granted,
Right.
right? Because it is.
We hear a lot of things like,
yeah.
I didn't take it, man. I'm all right. We hear that. Yeah, we
Yeah,
do.
thanks to the people who did.
So, yeah.
Yeah.
Okay. Now, makes sense, yeah?
Yeah.
Okay. Did you know that, Chinta? Yeah. All right. So for kids, it's very important to kids especially, yeah?
Yes.
And what should parents do if they've missed a vaccine appointment for their child? Wait, hold on. Oh, yeah. Okay. We'll go to the question above later. All right.
Okay, so if a vaccination appointment is missed, so parents don't need to worry. They just need to contact their healthcare providers to reschedule. It is never too late to catch up.
Right.
Yeah, healthcare professionals, they have a catch-up schedule, which will enable the child to receive any missed doses effectively and safely. But it is also important to note that delays can actually leave a child temporarily unprotected. So as I mentioned earlier, then they are unprotected, they are at risk of contracting a vaccine-preventable disease. So it's very important to get them back on track as soon as possible. Yeah.
Right. And it's so sad when you think about countries that have got to go through war and the children not being able to be vaccinated and get all these kind of privileges. Yeah. And all that kind of things where they block vaccines and medicines reaching the people, like what's happening in Palestine now and all.
Yeah,
right?
it's very sad.
So those are the things that actually are the side effects that we don't see or we don't think about directly when we think of war. You would think of, I don't want my house to blow up and that's all. But no, there are so many other things that are killing the people and that's not getting the proper medical treatment. So when you do have that privilege of being treated properly and having vaccination beforehand, please, take advantage. If there's anything you should take advantage of, it's that.
Yes, we are so blessed to be in this country.
Correct.
Yeah.
Yeah. Okay. Are childhood vaccinations only available at government facilities?
Okay, no. Childhood vaccinations are not exclusive to government facilities. They are also available at private centres. Although the National Immunisation Programme is free of charge, if children were to get them from public healthcare facilities. In private healthcare facilities, they are available usually in packages. So they range between 850 about 2008, depending on the types of vaccines and the number of vaccines that are included in the packages. Yeah.
So, wow, if you can get to go to the government, you better.
Yes.
You better, right? It's like how much cheaper would that be?
It's zero cost.
Right?
Yeah.
So it's not even a ringgit charge, no?
Maybe for registration, yeah.
Maybe, yeah. So, yeah, come on, Okay. Most people associate vaccines with childhood immunization. But what is the role that maternal vaccination, what role does maternal vaccination play before a baby is born? Before a baby is born?
Yes. Well, your question is very timely.
Right.
The Ministry of Health actually recently announced that the Tdap vaccine, which protects against tetanus, diphtheria and pertussis, is now available for pregnant women between 28 to 36 weeks of gestation.
All right.
So
listen, ladies, listen.
Yeah. So they can get these vaccinations from primary healthcare facilities that provide maternal health services nationwide. So maybe you're wondering, how does this then protect the baby?
You're a mind reader, yeah.
All right. So how it works is that immunization helps the mother to produce antibodies. And these antibodies can then be transferred to the baby in the womb through the placenta. So the babies are actually protected since birth.
Okay.
Right from birth, they are protected. And actually, this early defense is actually very crucial, especially during the first few months. It's the critical moment because these children, these babies, they are too young to, be fully immunized. Yeah.
Oh, okay, so it's got to work that way, right? Mother's got to be given the jab and then it can get to the kid, right?
Yes.
So it doesn't work like if the mom's carrying the baby and the mom eats chili, your child develops certain problems, or if the mom eats a lot of ketchup, your child becomes, right? There's always that story, yeah, that women always hear, which is rubbish, yeah? Okay, all right. I said it for you, don't worry. Okay, now, wow, okay, so that one is important. Moms should know. Is that popular right now? Is that something that should be done right now?
Actually, it's been around for a long time now.
Okay.
But just recently, it was announced that women can actually get them at government facilities.
Right.
Yeah.
And it doesn't harm the baby in any way.
No,
Right? So so get that out of your head if you've heard that before from someone.
In fact, it protects the baby.
It protects the
Yes.
baby even more, right?
Yes.
Okay. Yeah, I'm very worried about what people are saying, like you said about the myths and all that. That's the problem, yeah? A lot of times, like, you want to buy a house, and then you go and look at the house, and you love the house, and you like it and everything, and then all of a sudden you speak to your auntie, and your auntie says, no, don't buy that house because... and then, all kinds of things go true, right? So for somebody in your position, how does that make you feel? Like if put yourself in the shoes of a real estate agent. If you're, in this case, like how does that make you feel when people do that? And they
Well, for me, I guess it makes me more motivated so that I can set the record straight. Yeah. So misconceptions are nothing new. I guess everybody is akin to their own perception, But it's important to set the record straight. It's important to get the right information, correct information, accurate information. And I just hope that the community will turn to professionals to get that advice.
Right. What about, people who would go to, complementary medicine and say that it does the same thing as, your vaccinations?
Complementary.
Like maybe, they say like, go see the seafood. The seafood will give you better immunization or whatever. Chew on this root and you'll be all right.
Actually, I have yet to encounter
Okay.
such. Yeah.
How?
I don't know whether there's some bold statements on that.
Yeah.
But yeah.
Right. What is the most ridiculous ones you've heard besides that one I just told you?
Actually,
the most ridiculous ones that really please don't believe this. Like you would cringe if you're driving in your car every time you've heard it.
Well, I can't think of one over the top of my mind right
but
now.
it was ones that we discussed earlier.
Yeah,
mainly.
Just wait for the infection to just take its natural course, and my child will be fine.
Right.
Yeah.
Don't do that. Yeah, you're endangering your kid. Yeah.
Correct.
It's very important. All right. So finally, what message do you have for listeners regarding vaccination?
All right. So the final message or take-home message for everyone today is that vaccination saves lives. Vaccination is one of the safest and most effective ways to protect children from serious diseases. And our NIP is safe and reliable. All the vaccinations in our NIP have been thoroughly tested. They are constantly monitored and they are backed with decades of solid research. Through the NIP, we have eliminated diseases and drastically reduced many others. So, as I mentioned, immunization saves lives. Let's do our part to protect our children and ourselves.
Nice. Okay.
Yeah.
And those contact numbers again
Yes.
or places to go to?
Yes. So if you have any further inquiries, feel free to contact the National Pharmacy Call Center, the NPCC, at 1-800-88-6722. I'll repeat that. 1-800-88-6722. We are open from Mondays to Fridays from 8 to 5 p.m., except on public holidays. And also for those who are tech savvy, don't forget to check out our Kenali Ubat Anda on our social media platforms like Facebook, Instagram, and TikTok for latest announcements and information.
Fantastic. Love that. Yeah. Okay. Thank you so much. Thank you for enlightening us with a lot of information that we should know and don't shy away from vaccinations. Yeah, folks? Okay. Vanessa Liang Luwen, absolute pleasure having you here at Traxx.
Thank you for having me.
From Chenta and from all of us here at TRAXXfm, from our bosses, producers, and DJs, we thank you.
Thank you.
And we hope to see you, maybe having a nasi kandar, but not because we need to go for treatment or anything like that, yeah? Thank you. Absolute pleasure.